So this is the second in a series of chair-based exercise sessions you can do with older people in care homes. Just a reminder, before you do any of these, you need to go back and have a look at the video on risk assessment. You shouldn't be exercising anybody unless you've done a proper risk assessment on them first. So, in the last video we looked at some basic mobilisation exercises. We're going to use the same structure to have a look at doing a basic stretching session with older people. Stretching, they tend to recommend about 12 to 15 seconds as a sort of a basic stretch. Stretching can go anywhere between a held position for 2 seconds all the way up to 3 minutes. With older people, I wouldn't really worry so much whether they got to 12, 15 seconds or whatever. If they can manage to hold a stretch for a couple of 3, 4, 5 seconds, I'm happy. If I can get more than that out of them, I'm happier still. So we're going to use the same structure to see what stretches are worth doing and what stretches are not worth doing. And I want you to keep in your mind, just because you can stretch something doesn't mean that you should. Some of the bits that you can stretch are not functional or any good for day-to-day life for an older person. So if you have a look at your fingers with that in mind, you can stretch them. And I've had people on countless courses give me lovely reasons why you'd want to stretch your fingers out. But when you think about day-to-day life, the only good reason to stretch your fingers is if you were going to do some mine work up at the local town centre to earn a bit of extra money. Generally, it's a complete waste of time. It's the same as stretching your wrists. I can stretch them, but for the average old person, there's little point. If I work my way up to my arms, we come to some of the stretches you'll probably know yourself if you've been to a gym or done some exercise classes. So traditional version here would be a stretch coming over the head for the back of the arm. If you look at that and teaching that to someone with dementia, there's a lot of coaching points to get that into position. So it would be a 1, a 2, a 3, a 4, and a 5 with the head coming up. I tend to just ask them to brush their hair. And when they can brush their hair, I ask them to reach down as far as they can. I then go and do the other hand the same way. If they've got problems bringing the arm up, I would ask them to scratch their chin while supporting the elbow. Work their way up to an earring or to the ear, to the back of the neck, and then it starts to resemble what you'd see as a traditional tricep stretch. I don't tend to use the anatomical names for the stretches. I just say back of the arm. They don't care, and if you're watching the video, probably yourself, you really don't care that it's your tricep, your bicep, your deltoid that you're stretching. It's just the area that you're going to work. Another common stretch would be a shoulder stretch. So again, that's probably got about 4 coaching points to get it into position. An easier version is just to wrap your arms round, and then I'd get them to do that again. As I work my way up to the neck, you've got up and down. So the up, you can get impingement on the neck, and sometimes they'll complain about dizziness. I don't tend to do it. What I do is the down with relaxed shoulders, and that's a nice stretch on the back of the neck. If you try it yourselves, you'll figure that out. Looking over one way, looking over the other way, resting the ear on the shoulder, and resting the ear on the shoulder. There are more stretches you can do for the neck, but that's nice and basic and simple. If we start to work down the back, we'll come down to the lower back. So the easiest stretch you can do by far is to get your feet out. Actually, if they've got their feet into position here, I wouldn't even bother moving them. I'd get them to come down and to hold that position. What it does is it stretches out the lower back, which helps them stand up out of the chair. The next one along, if you can get them to do it, is legs out straight and reach down. Now, if you watched the previous video on mobilisation, you'd have seen that I asked them to touch their knees first. If you ask most people to touch their toes, they'll tell you they can't do it. In nearly 30 years of teaching, I've never had anybody tell me they can't touch their knees. So it's a nice, easy way to get them down into the stretch. The one that I rarely do would be the YMCA sort of special seated exercise, which is a leg here, leg out straight, spine up tall, and bringing it forward. It's a far more effective stretch of the back of the legs. The problem is if they've got any type of dementia at all, it is really hard to coach that into position. So I tend to stick with either one of the first two that I've shown you. Then we've got a rotation of the spine. So as you can see, I've got arms on here. I'd use the arm, pull myself round and look over. And then the same sort of thing here. I can do it with a hand on the leg. And it's an identical stretch, just a different version of it. Or back to what we've done before, which is just a sort of 1950s, 1960s exercise style of rotation for the spine. Then hand to the side. So if I'm getting them to bring a hand down to the side, the main coaching point you're looking for would be any sort of gap between their buttock and the chair. It's important that the buttock stays firmly on the chair. It's not unusual sometimes for people to complain of a pain when they go down to the left side. Never read it anywhere, but what that's turned out to be 9 times out of 10 is constipation. So it's one of the joys of working with the elderly. You discover all these lovely conditions. So you repeat that on the other side, same sort of thing, make sure they're breathing. Then what we've got is we've got back of the legs, which we've already done with the stretch that came forward, front of the legs. Cut to the chase of it, there isn't a safe way that you can do an older person with balance problems to stretch the front of their leg. The only way that would even be vaguely safe would be actually on a bed in their room, definitely not in a group setting. Then if we run down further down to the foot, you've got pulling toes up. There's 2 variations for stretching the calf, and this is the simplest. You can also get another stretch where you point the toe away. The better stretch is you sit them forward, pull the heels back and lean into it. And that stretches out the tendon that runs here. Again, in my experience, there's a lot of older people in care settings. This stretch would be a recipe for disaster. So the other stretch is probably preferable, especially if they've got some sort of dementia. Remember, those stretches, they're held for a count of 1, 2, 3, 4, 5, about 5 seconds. If they can't make 5, get them to hold whatever they can and try and make sure they're breathing. Always a good start. I hope that little session's helpful for you, and I'll do another one on a variation of stretching.